The number of coronavirus cases and deaths march ever upward as tensions persist over the need to impose restrictions and the desire to resume normal activities. With classrooms closed for now, parents get creative by forming backyard pandemic pods so kids can learn and socialize in small groups. And prosecutors enjoy big advantages over defense attorneys in criminal trials. The impact of inequities in our judicial system. I'm Mark Sauer, and the KPBS Roundtable starts now. Welcome to our discussion of the week's top stories. I'm Mark Sauer, and joining me at the KPBS Roundtable today, Taryn Mento, health reporter for KPBS News, Kristen Taketa, education reporter for the San Diego Union Tribune, and watchdog reporter Jeff McDonald, also of the Union Tribune. The first reported case of COVID-19 in San Diego was on March 9th. Now, here we are 15 weeks later, and there's no end in sight. This week alone, we saw a daily high in reported deaths, with 18 on Wednesday, along with nearly 600 new cases. And those who work in our hospitals are once again sounding the alarm that they need more help. Joining us to sort through the headlines is KPBS health reporter Taryn Mento. Hi, Taryn.
Hey, Mark.
So explain to us the brief drop and then followed by a surge in new cases this week. Do health officials have an idea of what's behind it? Are there theories out there?
Right. So, we've been hearing about this case surge. We've had cases over 500, cases over 600 on some days. And then, earlier this week, we got down to 385 and it had been kind of a decline. And people were probably very hopeful about it. But then, as you just mentioned, back up to 587 cases on Wednesday. On Thursday, officials reported 501 positive. So obviously it wasn't, or so far we hasn't been shown to be a downward trend. But we've seen these kinds of fluctuations before. It's not unusual for that to happen, especially earlier in the week. Testing results can be delayed. So you're getting results from testing done maybe days ago. And if that's testing done over the weekend, that's when a lot of sites are closed. So there's the amount of tests might be lower. And the county notes, sometimes it gets batches of earlier tests included in these daily case reports. So there's a lot that has to do with just when things are reported that can maybe change from day to day. And that's possibly what that could have been.
Some communities in South Bay were the hardest hit. Is that still the case amid this latest surge?
So, looking at a map of the county by zip codes, certainly we are still seeing a large number of cases in the South Bay area. And there's a very large Latino population in that area. And we know that Latinos are disproportionately affected, not only in terms of cases, but, deaths too. And the Chicano Federation is calling on the county to improve its outreach efforts in the Latino communities. And the county this week also itself said it is working to do that. It's increasing its outreach campaign, more digital radio and TV ads in Spanish and English, encouraging safety practices like facial coverings. So it is a little bit difficult to track, but certainly in that community, another hotspot we've seen is El Cajon. Another hotspot that my colleague Claire Tregeser wrote about recently was also Pacific Beach. And there's a couple of zip codes up in North County. So yeah, definitely huge numbers of cases in the South Bay. We've seen that for a while, but we've seen other hotspots pop up as well.
Clearly, we need to get a lot smarter overall as we go along. Now, Dr. Wilma Wooten, the county health officer, said we need to get daily cases down to around 230. That's less than half of what we're seeing lately in the numbers you're talking about. Seems like a heavy lift given what we're going through now.
Yeah, I don't know if there's much more to say about that, Mark. I mean, we're talking about 587 cases on Wednesday, 501 on Thursday. I mean, to get it down to 234, which is, what we were at weeks ago, if not months ago. And so we've had more reopenings than closings, so it's going to probably take a lot of, I think what the county is pushing is compliance with the safety measures that they're talking about. And those are the same ones we've constantly been hearing about, which is wearing your mask or your facial covering, making sure you're constantly washing your hands, don't touch your face, socially distance, making sure that you're staying 6 feet away and don't gather. We haven't heard about too many outbreaks linked to private residences, but those were early on where a lot of outbreaks were being linked back to. Since then, it was restaurants and bars, and there's a variety of other businesses that it's being linked back to. But also the issue is gatherings as well.
So say the same message again and again. What more can they do? Now, county supervisors this week discuss what's being called the Safe Reopening Compliance Team. What's that?
This is going to be what it looks like a partnership between the county and cities to take staff members, employees, probably their code enforcement teams to kind of not patrol, but to respond to complaints that maybe the county is aware of or to that's reported through 211 about these businesses that maybe need a little bit help or who are refusing. We've heard about that. Some gyms are refusing to close down, even though the governor ordered it. About a week ago, actually. So these are teams that are going to respond to and further enforce the public health orders, especially with businesses who are being openly defiant of the rules. And we expect to hear more details about that. It's kind of only been, announced this week. And so we hope to hear more details about that next week. That's what Dr. Wooten said we would hear.
Now, backing up a little, the national case numbers are really scary now. It took 99 days to reach 1 million cases in the U.S., 43 days to get to 2 million, 28 days to get to 3 million, and just 15 days now to get to 4 million this week. And that was on Thursday. And now California is seen as the country's hotspot, even though we shut down as early as anybody in the country. Daily new cases in the state hit 13,000 earlier this week. Explanation for why the numbers are taking off after California's earlier success? Is it just more of what we're talking about in San Diego County, and it's difficult to put their finger on it?
Wilma Wooten has kind of linked a case surge back to reopening in early mid-June. So there is talk about, did we, and not just San Diego, did the state move a little too fast with reopening? There's a great report by Los Angeles Times, Taryn Luna, and I love giving praise to fellow colleagues that do great work, but she and I share the same name. So I especially love giving her a shout out.
Right, that's good.
She did a great, article at the Times pointing out that, we reopened before the state met some of its own benchmarks, specifically with testing. The governor has said, though, that counties attested that they were able to meet state criteria before they could open. And then there's this debate over local control, and the county, public health officials all across the state attested that they could handle this. But then it just, we saw more state guidance coming down from more and more sectors that these counties who had previously attested that they could meet certain phases were then allowed to add on. And so there is the question, was it a little bit too much too fast? But we did expect some kind of bump anyways from reopening, just because it was more people interacting. And that's why counties like us, the county has these triggers that alerts them when activity is just spreading a little bit too much and we need to pull back.
Yeah, ratchet it back. Well, nurses raised the alarm this week. They're not getting the equipment they need. Again, Governor Newsom touched on that and talked about how the state's working to supply more masks. What have you heard about the situation at our hospitals and the ability to work safely?
So we have those triggers that I mentioned. These are metrics that the county is monitoring to make sure that things aren't getting, beyond our control. And one of those looks at hospital resources, and specifically it looks at PPE supply, personal protective equipment supply, and that's gowns and facial coverings and masks and booties over your feet, gloves, etc. And so the county makes to make sure that every at least half of the county's hospitals have at least 15-day supply of this. And right now we are, I think it's about maybe 72% of county hospitals have that kind of supply. So locally, we seem to be doing, as pretty well or okay. And I haven't heard about too many facilities getting into dire situations, but there are questions, just statewide about these materials, these PPE materials that the state is procuring and where they are going and how the state is deciding where to send them and what their quality is. That was talked about by the governor earlier this week. There weren't a lot of specifics, but I expect that a lot of journalists will be following up on this, and I myself will be reaching out to some local hospital systems and healthcare providers to kind of find out if we can learn more about that.
Well, that's one question and story that you're looking at. And of course, your beat, the health beat, is very busy. Other stories and questions you're chasing as we move ahead into the next week or two?
Yeah, and I'm happy to talk about it, because if I talk about it, that means that I actually have to do this. So this is great. This is going to hold me accountable. One of the things that I'm definitely moving forward on is helping the public to understand how this flow of information, when we're talking about the triggers, how are we getting the information that the county is calculating and then reporting out to the public, out to journalists? How is that flow of information happening? And there's a lot of steps there. And so I'm going back to a number of different healthcare providers and labs to learn more about that. But then kind of on the non-COVID side, but also still COVID, chronic illnesses and disease, cancer is still happening to people. People still need to get these kind of critical care and treatment, but it really, really complicates things. And so I'm looking into how do we continue to make sure that kind of care is getting to people who need it and who are sick right now at a time where being out to go get your care is kind of nerve-wracking.
I've been speaking with KPBS health reporter Taryn Mento. You can find her work at kpbs.org. Taryn, thanks for joining us today.
Thanks so much, Mark.
¿Qué onda, friends? In this episode of Port of Entry, we wanted to share the live event experience we hosted together last year as part of the World Design Experience with special guests Charles Glaubitz and Giancarlo Ruiz. You don't want to miss this two-part episode of our live event. Catch us wherever you get your podcasts. Nos vemos pronto.
Parents, teachers, politicians, employers, and students have all been saying the same thing since schooling moved from home computers in the spring. Kids need to get back in classrooms, as much for the social benefits as for the book learning. But that's not going to happen anytime soon in San Diego and most of the nation amid this pandemic. So some parents have gotten creative. Joining me to discuss a new trend in education is Kristen Taketa, education reporter for the San Diego Union Tribune. Kristen, welcome back to the Roundtable.
Hi, thank you for having me.
So we're talking about learning pods, or pandemic pods, as some are called. Explain the idea behind this new thing.
Yeah, they're also kind of sometimes called micro schools, but that's basically what it is like a mini classroom or a mini school. And they kind of take on different forms, but basically it's a small group of children and their families or usually the ones organizing this, but it's a small group of kids that meet basically for classes. It's either parents might be leading the pod, or they might hire teachers or tutors to help lead the pod. But basically there's an adult, at least one adult there, helping the kids with distance learning assignments that they get from their school district or from their school, or they're just helping them with learning in general. Or some of the pods are more just for social reasons, just to get kids together so that they have some, social outlet or some chance to have play dates with other kids, just because everyone's been so isolated with these school closures. And that's like one of the main concerns that everyone is having, is that the closures are impacting students' mental health. So this is meant to be one of the solutions for that.
Yeah, life can't be all done on screens alone. So you interviewed Lauren Holman, the mother of a second grader in San Marcos, about forming her pod. Tell us what she's organized. How does it work?
Yeah, so she organized her pod by basically getting in touch with parents she knows through her school already, her child's school. Fortunate in that she already had that kind of a network. So the parents basically just organized it together. Since it's going to be led by the parents themselves, they're not going to have fees like a lot of other pods will in terms of fees for teachers or tutors. But Lauren is also fortunate in that she herself is a teacher, and she said one of the other parents in her pod is also a teacher. So they have that benefit of already having teaching experience to help lead the pod. And so, yeah, the parents basically will just take turns leading the pod and hosting it, either in a backyard, their home backyard, or at a park. They'll take turns hosting it and watching over the kids. And there's about roughly half a dozen kids at a time in the pod, I believe. And so it's kind of like a parents sharing the responsibility of teaching and watching the kids. So it's like a sharing effort there.
And another parent in your story said he was so desperate, he was considering moving to another country to get his kids back in school. Tell us about Scott Rapp and his experience.
Yeah, so Scott has actually started one of the local San Diego pod chapters over the weekend after he heard that Governor Newsom is keeping schools in San Diego County closed until our COVID gets better. But yeah, in the beginning, as he was leading up to the governor's announcement, he was considering he was going to move to a private school because he thought that a private school would be more able to have in-person school than the school district he was in. So he's been really wanting in-person school for his kids because they're so young. I think his oldest is 5 years old. At one point, he was even considering moving his family to Sweden where they didn't close schools and his family also likes to travel and they could work from home. But yeah, so he was very desperate to find an in-person option. So the pod was what he came up with, since that was the most realistic one he could focus on right now.
So as you say, Lauren Holman has experience as a teacher, but some other pods are hiring tutors. That can get pricey for parents, right?
Right, definitely. I mean, the rates are kind of all over the map, but I've seen number of rates over $50 an hour. And so that's where, we kind of get into these questions of equity, because if you don't have somebody who has that teaching experience or is able to lead a pod, then at that point, it's almost like it could be a resource that is only available to families who can afford the extra money to pay for all this extra support for their kids. And I mean, that just goes with the whole narrative of equity that's been going on since the pandemic started for schools. I think Scott Rapp estimated that a pandemic pod could cost as much as $270 a week per student. So that totals up to a lot of money for some families.
Yeah, pushing $800, $900, $1,000 a month. That can get really pricey. And that is the argument, though, that some kids who have advantages over low-income students anyway, because their parents and their neighborhood schools and what they can afford in school. And it's kind of the same thing when you get into this private pod situation.
Right.
And before wrapping up, I wanted to ask you about another story you did involving a conservative attorney and her group that's suing Governor Newsom over his order closing classrooms for the time being because of COVID-19. Who is she and what's the thrust of her lawsuit?
Yeah, so the lawsuit is being led by this group called Center for American Liberty. That group is led by Harmeet Dillon, who is a member of the Republican National Committee, and she's an attorney. So their argument for that lawsuit is that by Newsom forcing schools to close in most of the state's counties, that is effectively denying the kids in those counties a meaningful education by blocking them from the chance to have in-person school. And then the lawsuit includes several families who are plaintiffs and who are, just have stories of how the school closures have really harmed their kids, either in terms of social or mental development or in terms of academics or both. And so this is kind of going along with that whole pushback or arguments against the school closures and that desperation of parents who want in-person school again.
Is Harmeet Dillon and her group likely to get anywhere with this lawsuit?
I'm not sure. I wouldn't be the best to say, but the governor's office response to this lawsuit, the governor mentioned that no federal court has so far ruled against the governor's COVID actions. So I think the governor is just saying that, or the governor's office is saying that he did this school closure order in using his emergency authority regarding COVID. So, and he did do this because he said, this is necessary for keeping students and staff safe. And this is just happening in the midst of the ongoing coronavirus surge. And so a lot of people are saying that they wouldn't be comfortable in going back to school because of the growing coronavirus cases.
Yeah, the way it is in the midst of a public health crisis. I've been speaking with Union Tribune education reporter Kristen Taketa. Thanks, Kristen, very much.
Yeah, you're welcome.
¿Qué onda, friends? In this edition of Port of Entry, we are telling the story of Charles and Giancarlo, two compadres who recently put together a graphic novel titled The Fracture. Along with this podcast episode, we are premiering Port of Entry Shorts, small video capsules of the stories we put together, and we have two to share. Catch us wherever you get your podcasts. Nos vemos pronto!
The overwhelming majority of people arrested and then charged with a crime are guilty in San Diego and across the nation. And the vast majority of criminal cases plead out and never go to trial. Our judicial system could not function if it were otherwise. But it's also true that the prosecution on behalf of the people enjoys deep advantages in this adversarial system. Joining me to discuss inequities in the court system is watchdog reporter Jeff McDonald of the San Diego Union-Tribune. Well, Jeff, start with some basic facts. How many defendants cannot afford an attorney, and what happens in those cases?
Well, the majority of defendants can't afford their own attorney. It's about 80%. The district attorney's office told me 1 in 5 defendants can afford to hire their own lawyer, and that leaves the rest to the county public defender.
And that's an agency just like the district attorney on the other side of the aisle, and they get assigned somebody, an experienced attorney, and they've got a lot of cases, don't they?
Yes, the caseloads can be very high. In San Diego, neither the prosecutor or the public defender is hugely bothered by the discrepancy in the budgets. It's a little unfair comparing budgets, but I found it the only way to really look at how we set our priorities as a county. The DA budget is about 2.5 times the public defender, but they're quick to say they do a lot of other services besides prosecuting defendants.
And then the DA points out that they have to work every case up as if it were going to trial, even though most plead out.
Yes, there's a lot of legwork involved in getting to the point, they say, where they have to prove guilt beyond a reasonable doubt. In addition to that, they get brought cases from police departments across the county that don't result in criminal charges, cases they have to spend time and money and staff hours investigating before making a determination that they're not worth going to criminal charges. So there's an invisible caseload that the public doesn't see that the district attorney also has to review and investigate and evaluate.
And we've had a number of notable cases here and across the country in recent years where defendants were falsely accused of terrible crimes, including murder and child sexual abuse, and acquitted at trial, or the convictions were overturned, often by DNA evidence after defendants served many years. Are these injustices the result of this inequality that's built into the system?
Well, I would hate to say yes, that seemed to be a generalization, but people get convicted wrongly all the time, partly because of the way the system is stacked up against them. Public defenders sometimes don't have the resources they need. Now, again, the San Diego public defender insisted that he has never had to say no to a client for budgetary reasons. That's not always the case in other jurisdictions. In fact, the state and Fresno County were sued a few years ago because the majority of public defenders in that county wrote a letter complaining that they had 150 cases each, which was way over the guidelines. That case recently settled with a promise by Fresno County to divert more resources to the public defender's office.
And of course, as you say, the public defender here is not really complaining about budget size, but it would just stand to reason if they had more money, that would be more attorneys, more investigators to work on cases, et cetera, and maybe swing the balance a little more equally between them and the advantages the DA has, right?
Yes, that's what he said. Now, he did say he had a wish list of things that he would like, and they didn't include more attorneys or more investigators. What he wants is staffing for additional programs that he thinks will help head off prosecutions in the first case, social service programs, mental health services, housing assistance, things like that you wouldn't necessarily presume a public defender to be involved with. But he's looking at it from a higher level and seeing if you can put his clients in a position where they're not going to be arrested or charged or commit crimes. That will lower the crime rate and reduce his caseload at the same time.
Well, that leads me neatly into my next question here I wanted to get to before we wrap up. We're in the midst of a period of criminal justice reform, including an easing on the tough on crime legislation in recent decades that's resulted in millions of Americans behind bars, plus movements to reform city police departments following the George Floyd killing and subsequent protests. Is that affecting the working relationship between the DA's office and the public defender? Are we seeing moves toward reform there? You know, the sort of things you're saying about doing different types of things to keep cases from getting to the court system to begin with.
Well, I think it's certainly affecting this district attorney and this public defender as much as any across the country, because these have been remarkable shows of of demands for change from coast to coast. However, that said, these two officials have a pretty collegial relationship and have a mutual respect for the jobs they each do. They both have more initiatives they would like to implement, more programs they'd like to start. Neither of them are sure how it's going to shake out. Now, San Diego hasn't adopted its budget yet. Both the district attorney and the public defender told me they don't expect to get additional resources this go around because of the decline in revenues due to the pandemic.
So some of this stuff is going to have to wait. And you interviewed District Attorney Summer Steffen, and she said she's got her own wish list and has some things in mind going forward toward these same kind of reforms we're talking about here, right?
Yes. They both are committed to ensuring justice, and both of them take their worry seriously. I didn't sense the animosity between them that you would expect and that you've certainly seen in other jurisdictions around the country. But as I said, we thought that this was a good time to examine the respective roles and their respective budgets of the two offices, given all the attention that social and racial equity issues have been coming forward.
Have you gotten a lot of feedback and reactions to your story?
I did get a lot, yes. Some people thought I was glorifying the public defender and denigrating or questioning the prosecutor's roles. Some thought it was preposterous for think tank types to come forward with ideas like holding prosecutors accountable when they lose cases, that's not workable. At the same time, I got a lot of positive feedback from readers saying that it's important to explore these sorts of issues, especially at a time like this when we're having a national reckoning on equity issues.
Yeah, it makes for a very good conversation. Well, I've been speaking with Union Tribune watchdog reporter Jeff McDonald. Thanks very much, Jeff.
You bet. Thank you, Mark.
That wraps up another week of stories on the KPBS Roundtable. I'd like to thank my guests, Jeff McDonald of the San Diego Union Tribune, Taryn Mento of KPBS News, and Kristen Taketa, also with the Union Tribune. If you ever miss a show, you can catch up with the Roundtable podcast, available on your favorite podcast app. I'm Mark Sauer. Thanks for joining us today, and be with us again next week on the Roundtable.
Now on The Finest, we examine an icon. Our Lady of Guadalupe has been a powerful symbol for 500 years, and artists have reimagined her as a source of resilience and pride. Listen now wherever you get your podcasts.